Hypoglycemia and hyperglycemia are big words. They even sound the same. However, for people with diabetes, these words are very different. In fact, exact opposites. So let's learn about highs and lows and why they are important. Brought to you by Baylor Healthcare's Diabetes Health and Wellness Institute and MyCareConnect. The only thing that hypoglycemia and hyperglycemia have in common is the word glycemia. Everyone has glycemia. It isn't a disease. It simply means the level of glucose, or sugar, in your blood. We refer to it as your blood sugar, and it's easy to measure that level today thanks to blood glucose meters. The number that comes from that meter after testing your blood sugar is important. It tells us whether your blood sugar level is too low, typically under 80, in a good range, say from 80 to 180, or too high, anything above 180. Low and high blood sugar ranges do vary from person to person, so be sure to consult with your doctor to know your specific ranges. So let's better understand hyperglycemia, which is when your blood sugar is too high. Without having a blood glucose meter handy to verify anything above 180, some common symptoms of hyperglycemia include extreme thirst, frequent urination, sleepiness, hunger, blurred vision, or a lack of concentration. Be aware that some people may not feel symptoms, and so they aren't aware they are running a high blood sugar, even more reason to test often. So how does a high blood sugar happen? Typically, a high blood sugar is caused by eating more carbohydrates than your body can handle. As we learned in our video, What is Diabetes? It means you don't have the right amount of insulin to help process those carbs. There can be additional factors that can cause highs, including decreased physical activity, illness, stress, injury, infections, hormones, and menstrual periods. But the main one is the food you eat. If left untreated, besides some of the symptoms described earlier, a potentially life-threatening complication called diabetic ketoacidosis, or DKA, can occur. The important thing to do is to know what to do when you have high blood sugars. If you have a high blood sugar, it should be treated by taking any medications per your doctor's orders and really getting plenty of water in you. You should also recheck your blood sugar every 2 hours and continue to keep fluids going until your blood sugar is in a good range. Of course, if you have any questions, contact your doctor or nurse. Now it's time to talk about hypoglycemia, which is when our blood sugar is too low. Without having a blood glucose meter handy to verify, some common symptoms of hypoglycemia include shakiness, sweating, irritability, confusion, or difficulty speaking. Part of the reason for this is that our brains actually need glucose, and if you have a low level of it in your blood, your brain is not getting its usual needed supply. Low blood sugar can be caused by too much alcohol, too much physical activity, and not enough food in your body. Another reason for a low blood sugar is having too much insulin or oral diabetic medication in the body. Imagine a person who takes 5 units of insulin for 2 slices of pizza and then decides to eat only 1 of the slices. Now you've got too much insulin and not enough carbs. This will lower the blood sugar to potentially dangerous levels. Knowing how to treat a low blood sugar is critical. If a low blood sugar is happening, it should be treated immediately with fast-acting carbs. You will then need to retest your blood sugar in 15 minutes, and if you're still not up into the good range, you'll need to repeat the process. If a blood sugar gets extremely low, you may not be able to eat or drink, or might even become unconscious. In this case, a glucagon shot should be given. We cover this in our video on how to use glucagon. What's important to know here is that your close friends and family members should all be taught how to use glucagon in an emergency, and be prepared to call 911 if unsure what to do. Low blood sugars can be scary, so keeping a small, sugary snack nearby is smart and will give you and your family some peace of mind, especially if you plan to drive. If you have diabetes, it's important to check your blood sugar often to stay in that good range. Understand what triggers those high and low blood sugars and how to prevent them. Be prepared to treat them when they do happen, and lastly, take the time to educate your family and friends. This is very important. Always remember, if you have any questions, be sure to consult with your doctor or CDE, especially if you continue to have out-of-range blood sugars.